Hi, my name is Essie. I'll be your nurse today. I have some orders to do. Check your lung sounds, listen to your heart valves, and to do check your head, eyes, ears, nose, and throat, and to check your upper and lower extremities, range of motion, and for safety.
All right.
All right. I'm going to provide privacy, perform hand hygiene. Can you tell me your name and date of birth?
Jane Doe, May 1st, 1998.
All right, can I see your wristband? Thank you. Can you tell me where you are?
I'm currently in a room in the library.
Can you tell me what brought you here? What you here?
Assessment, physical assessment.
Physical assessment. Also, can you tell me what month it is?
We are currently in February.
All right, my patient is Orange, time 4. She told me person. She told me who she is, place, time, and situation. All right, so I'm going to just look at her head to see if it's symmetrical and midline to her body, which it is. I'm going to tell her to turn to the side, and I'll have a pen light to check and see if she have any drainage, and I will also make sure her ears are the right shape and symmetrical to her body, which they is, and no drainage noted. I will also have a pen light to check her eyes, which I will start outward, which I'm going to use this. It just looks great. Her pupils are equally round and reactive to light, and I'm going to see if they accommodate. I'm going to get you to look at that window, and then once I tell you to look at this pencil, I'm going to get you to look at this pencil. Look at the pencil. All right, her eyes accommodate. I'm looking at her nose. Her nose is symmetrical. I don't see any abnormalities. I'm going to check for her nasal cavity. All right, it's pink, moist, and intact. Can you press on each nostril for me and just breathe in and do the other side? All right, I'm going to look at her lips. Her lips are symmetrical and midline to her body. They're moist, pink, and intact. I'm gonna get you to open up for me. All right. Her oral mucosa is pink, moist, intact. Her teeth are shiny white, and her gum is tightly secured around the teeth. I don't see any lesions, bumps, or anything that's abnormal. Okay, have you been having any headaches?
No.
All right, so now I'm gonna get you to turn to the side. Check for JVD. Check to the other, turn to the other side. For JVD. Do you have any trouble swallowing?
No.
All right. Now I'm going to listen for her heart sounds. I'm going to start on the right side of the intercostal space. In the second intercostal space, that's her aortic valve. And I'll go laterally over to her pulmonic valve. Third intercostal space is her Erb's point. Fourth intercostal space is her tricuspid. Then I will ask her to lift up her breast for me, and I will listen to her mitral valve, aka apical pulse, for a minute. All right, thank you. I don't hear any adventitious sounds that are noted. Have you ever experienced chest pain?
No.
Okay, so for the purpose of this video, I'm going to listen on her clothes. In real life, I would listen on bare skin. So now I'm going to start listening to her lungs. All right. So I'm gonna do this is her left upper lung, and I want you to take a deep breath in and out. Well, this is her right upper lung. In and out. Left upper lung. Left middle long, right middle long, left middle long. Alright, I'm gonna get you to lean forward and I'm gonna listen to your back side. Alright. As I touch you, continue to take a deep breath in. Alright. That's her left upper lobe, right upper lobe, left middle lobe, left, right, this right middle lobe. Alright. I'm gonna get you to go back. I'm gonna get you to drape your arm to the side. I'm listening to her laterally anterior side of her lungs, lower side of the lungs. Breathe in, breathe out. Posterior. Alright, and I'm going to go to the other side. Do the same thing. Anterior, posterior. Alright, no adventitious sound noted. I want to teach you about the turn and deep cough method. What you'll do is you'll turn to the side, take a deep breath, and you'll cough out. That helps to prevent pneumonia and to remove any excess mucus. Also, I want to tell you about the incentive spirometer. What you'll do is you'll breathe in it, preferably 10 times an hour, preferably during a commercial break. And it helps open up your lungs and pretty much does the same thing by preventing those extra mucus. All right, do you have any trouble breathing?
No, ma'am.
All right, I'm going to check your capillary refills. Good, I'm going to check for edema. And while I'm up here, I'm going to go ahead and check for her radial pulse, which is bilaterally even. Then I'm gonna check for her duralis pedis, bilaterally even, her posterior tibial, bilaterally even, which is all 2 pluses. Then I'll check for her capillary refill in her toes, and I will check for edema in her lower extremities. Alright, so now what I want you to do for me, I'm going to get you to stand up for me. Can you close your eyes for me? Open them. Okay, good. Got good balance. I'm gonna get you to take 4 steps over there and back for me. All right, I'm gonna get you to have a seat and be careful. All right, now I want you to, I'm going to check your range of motion, and I'm going to check 2 up top and 2 at the bottom. So what I want to do is do your elbow. So this is extension, flexion, and we're going to do the other side, extension, flexion. Then we're going to do your knees, and I want you to, this is extension, kick back, that's hyperextension, and then put it back at rest, and then up, that's flexion. Do it again over here. Flexion. And then I want you to do, I'm gonna check your ankle, which I want you to look down. That's plantar flexion, tip up, dorsalis flexion. Do the same with this side. All right, and I'm gonna come back up here. I'm going to do your wrist, because I only did one. I need to do your elbow too. So this is extension, hyperextension, extension, flexion, extension, hyperextension, extension, flexion. Now I'm going to push against you, but I want you to pull. So, all right, hold your arms up like this, and I want you to pull. All right, pull. All right, push against me. All right, I'm gonna do the same thing down here. Pull. All right, push. All right, good job. So I'm gonna ask you a few questions about your fall history. In the past 3 months, have you had trouble falling? Do you have a history of falling? Do you have any secondary conditions? Do you use a walker or cane?
No.
No? Alright. So you don't need any assistance with your, everyday activities?
No, ma'am.
Alrighty. So I'm gonna make sure that you, your area is clean and neat, and make sure that all your personal items are close to you. Do you need to use the restroom?
Not at
Do
this
you
moment.
need any pain medicine?
No, not at this moment.
And, okay. So I think I have gathered all the information I need from you. So I will give this to the provider and I will come back, okay?
All right.
Thank you.